Today's topic is humanity struggle against COVID-19. Before I hand over the mic to Dr. Timothy, let me do the introductions. Dr. Timothy William is happily married to Ida Stimson. They have 4 children. He's currently the infectious disease physician at the Glen Eagle Hospital, Kota Kinabalu. Dr. Timothy is one of the members of the Ministry of Health Malaysian COVID-19 Vaccine Working Group Committee. Qualifications. Dr. Timothy graduated with MBBS from University of Malaya. He's a member of Royal College of Physicians UK and Fellow of Royal College Physician Edin. Members and Association is a president of the Infectious Disease Society of Kota Kinabalu, an honorary associate for the Institute of Clinical Research Centre in Malaysia, the Menzies School of Health Research, Darwin, Australia. He is also an associate investigator for the Australian Centre of Research Excellence in Malaria Elimination. Experience. He was formerly the Sabah State of Infection Consultant for 10 years when he served in the public sector. Honors and award. Dr. William and his team has numerous international journals publications on infectious diseases. He received the 2017 Merdeka Award for his work as an infectious disease physician and his research on Pinovelisi malaria. He also received the International Bill and Melinda Gates Travel Award from the American Society of Tropical Medicines and Hygiene and the John Forbes Travel Award from Australia Society of Infectious Disease. Now I would gladly hand over this space, this time, this platform to Dr. Timothy Williams. So Dr. Timothy, the floor is yours. Half an hour. God bless.
Thank you, Mr. Thomas Tan, for the very kind introduction. I'm going to talk about humanity's struggle against COVID-19. And these are the objectives, sir. I want to convince you at the end of this talk that our vaccines are here to prevent the SARS-CoV infection, and it's our own hope now of curbing this pandemic, to reduce the risk of being infected with COVID-19, to reduce the risk of severe COVID-19, including deaths, and also to reduce the spread of COVID-19. So this is the latest, not exactly the latest, on the 18th from the WHO site. There have been 177,108,695 confirmed cases, and of course rising, already including 3.84 million deaths in 1 year, just slightly more than 1 year. And as of the 19th of 163 cases, we already at 67,541. Until last year, Sabah was the highest number of COVID-19 cases in the country. But now it's been overtaken by West Malaysia in Selangor and Kuala Lumpur. This is a very important graph. This is the testing rate and COVID-19 cases positive rate by state in Malaysia. As you can see, the number of positive cases for just 1 week alone, is 38,911. And we always look at the number, but actually you need to look at the positivity rate. The WHO says we can only open up if our positivity rate is less than 5%. So what does this positivity rate mean? It means that out of 38,000, 11% are positive. That means 38,000 random individuals, they test. In Negeri Sembilan, 11.41, in the whole country, 6.93. Now, Sabah is doing better. Our positivity rate is 3.86%, which actually, by right, according to WHO standards, this is one of the key indicators that indicate that we can actually open up or relax our MCO. But we will wait and see how things turn out. Now, there's another data which is not included here. Now, for the entire 2020, entire 2020, March from COVID, when COVID first emerged, in Malaysia, 471 people died of COVID-19. 471 people died of COVID-19 for the entire of 2020. Now, in the last 7 days alone, 564 people have died of COVID-19. Right? 471 for the entire 2020. The last 1 week, 564 people have already died. More by more than 100, almost 100 than the entire of last year. So you see how serious the situation is. So this is the model of the daily observed cases in Malaysia. You can see in April the number has increased a lot. The infectivity, the numbers have increased, and now it's slowly going down. What is the cause of increase now? The increase usually occurs because the people may have been infected earlier. So what is it that happened here? What is it that happened here that caused the sudden increase? And I think this increase was because of the Hari Raya holidays, where people were traveling. The universities were organizing buses to bring children back, people back to their homes for Hari Raya. Back to their homes for Hari Raya. People were traveling, despite warnings made by many of us. So we are all paying the price for this right now. We are all paying the price for this lax, and now we're all locked down because of that. People need to learn that these are super spreading events that need to be stopped at all costs. So the number of deaths, the number of cases, our economic impact is all because of this. Our government and people do not seem to realize, have not learned their lesson. Last year, we had the Tabligh cluster, which caused an explosion in the state. We had the Sabah election, which caused an explosion in Sabah and later in West Malaysia. And now they open up during Raya. So these periods where people travel a lot, these are the ones that are going to trigger these super spreader events. Now, the real life results for the vaccines are actually very reassuring. This is a bit outdated. About of 4,900 patients that are vaccinated, this is Israel's number, 254 got COVID a week after their second dose. All the cases were mild. The efficacy rate was 91%, and 80% of Israel's variants were the B117 variant. Efficacy rate 91% means that compared to, if we look at all the people who get COVID, people who are vaccinated have a 91% chance probability of not getting the virus. And even then also, those who do get the virus, their symptoms are mild, the cases are mild. And they also did the viral load of 1,000 COVID-19 tests from December 2020 before the vaccinations began to 1,000, when most over 60s in Israel had been vaccinated. They found that the virus levels were much lower in the COVID-19 tests in January compared to December. So this theoretically would translate to reduced infectivity. This was seen in Israel, and this also is seen in all the other countries now. In the UK, in the US, the number of cases have all come down. Now, this is the daily reported COVID-19 vaccination in Malaysia. 12.9% nationwide have received at least one dose. 4.9% of total population has been fully vaccinated. So we only go by the percentages, we won't go by the number. And if you look at Sabah, 8.3% has been vaccinated the first time, and 3.4% have been fully vaccinated. So if you compare Sabah with the rest of the country, our vaccination rates are dismal. It's dismal. If you just compare with Sarawak, 21%. So I think this is not acceptable. And If the federal government cannot give us the vaccines, I believe that our state should take the initiative to get the vaccines ourselves, to get the vaccines ourselves. We are not vaccinating fast enough. And don't forget that up to January, Sabah had the highest number of cases. We are the third highest number of deaths in the country. Up to January, we had the highest number of deaths. So we as a state have already borne the brunt of the disease last year. And now West Malaysia is facing it. Now that our cases are low, this is buying us time for us to vaccinate our population as much as possible. So a bit of theory. Now, why is theory important? Theory a bit is important because I find many people, they are not doctors, this and that, and they're forwarding scientific talks by other doctors without really understanding the situation. They're forwarding it. So this is the virus. These are the two things. This is the spike protein, which you will hear. You hear a lot. Spike protein, and then this is the whole virus. Now, how do the vaccines work? The spike protein is important because this is what binds the virus to the human cell. They use the spike protein as a landing pad, to land on the human cell. So what the vaccines do is, most of the vaccines attack this spike protein. They alter it so that it cannot attach itself to the human cell. Okay, so the vaccine provides antibodies. The antibodies attack the spike protein, and so the virus cannot attach itself to the human cell. Now, there are also vaccines that cause antibodies against the entire virus. So these are the traditional type of vaccines where the virus is inactivated and then it is injected in the humans, and then the humans produce antibodies against it. So a bit of basic understanding. Protection induced by the currently available vaccines against virus is primarily based on virus neutralizing antibodies. Such antibodies usually block the interaction of the virus with the cellular receptor or prevent conformational changes required for fusion of the virus in the cell membrane. So basically, I think all of us know, when you get an infection, you get antibodies against the infection so that in future, you do not get infected again. So what the vaccine does is, it's not an infection. It induces your body to produce antibodies against the virus. So next time when the virus attacks, you already have antibodies to fight against the virus. And these antibodies attack the spike protein. I remember I showed you the spike protein. The spike protein, they alter its conformation, so the virus spike protein now cannot attach itself to the human cell. So this is a very busy photograph, photo. So this is the SARS-CoV virus. You see this green one is the spike protein. So this is called a receptor. The spike protein has a receptor binding domain, and it binds to on the host cell surface. It's called an ACE2 receptor. Okay, ACE2 receptor. You just remember these few things, ACE2 receptor, angiotensin converting enzyme to receptor. So what it does is it alters this. You see this green part. So then this virus, because this receptor binding domain is already altered, so it cannot attach itself to the human cell. The antibodies attack this one, so it cannot attach itself to the human cell. All right. So now the question is, how long will the vaccine be effective, and what type of immune response it produces, and how long the immune response will last. So there are three possible immune responses generated by the successful vaccine: the production of B cells or T cells or both. So you see here, So what happens is, again, just to make it simple, they attack the viral antigens, which is the vaccine, and then they activate the something known as the T cells and later the B cells. Now the B cells, what the B cells do is, the B cells, they are the ones that produce antibodies, which are called neutralizing antibodies. I mentioned to you just now. These neutralizing antibodies, look at this red spot, they attack the spike protein. They attack the spike protein and then it neutralizes it. But the question is, how long do these neutralizing antibodies last? It may be 3 months, it may be 6 months, but as in many cases, after a while, they find that the antibody levels come down. So when the antibody levels come down, does that mean that if the person gets infected, the body doesn't have enough antibodies? I'll give you an explanation for that. Now, it also activates something known as the T cells. Now, the T cells, they act differently. What the T cells do is, they actually attack the cell which the virus infects. Okay, you must remember one thing about viruses. Viruses cannot multiply themselves. Okay, viruses cannot multiply themselves. Viruses need the human cell to multiply. They cannot divide by themselves. They need to infect a human cell. So what the human T cells does is, it attacks the infected human cell, which is producing the virus. Okay, it attacks the infected human cell, which produces the virus. So it kills the human cell that has become the virus factory, and thus prevents the virus from further replicating. Okay, so I see again. So here, the cytotoxic T cells, they recognize the cells that are infected, and then they kill the cells. And then you have the B cells. What the B cells do is different. They produce antibodies, and these antibodies attack the spike protein, and then they cannot bind to the cell, and because of that, the cell is not affected by the virus. So there, it's a two-pronged attack. One, prevent the virus from attaching itself to the cell and infecting it. And number two, for the virus that escape and actually infect the cell, the T cells now, what they do is they attack the cell that is infected and kill the cell off, together with all the viruses. So antibodies produced by B cells attack the virus directly. Antibodies produced by B cells response to COVID-19 is short-lived. Now, it is possible, and it's found actually, that individuals who have been infected or vaccinated against COVID-19 could also develop rapid antibody response to subsequent exposure based on B cell memory. Now, you must understand. Remember, I told you earlier the antibody production comes down after some time. But actually, what the vaccine also does is it forms what is known as memory B cells and memory T cells. That means to say, although the antibodies are down, there are all these cells with the memory of the virus antigen. Memory. They don't produce anything except when there's a new infection coming, then the cells start to activate and produce antibodies. Then the cells antibodies. So both memory T cells and B cells response are specific to SARS-CoV-2 have now been found up to 6 months after the infection, and similar T and B cells might be expected following vaccination. So now many people ask, Doctor, can the vaccine work for 1 year, 2 years, 5 years, 10 years? How long can the vaccine work? The answer is we don't know, because we just produced the vaccine. So if I tell you the vaccine can work for 5 years and you ask me how to prove, well, the vaccine is only produced for 1 year. How do I know how long it will last? How long would I know what it lasts? I can only give you a theoretical answer. I can give you a theoretical answer. is I do not know how to uh, that analogy, like, you know. So you make something, you ask how long it can last. We'll find out how long it can last, but we already do know it can last for more than 6 months. 6 months. So selective pressure, this is something that's very important. Selective pressure occurs when mutant viruses that can overcome the immune system or the vaccines survive and spread. So this is what causes variants of COVID-19. Now you must remember, our immune system and also the vaccine, when they kill the virus, they usually don't kill all the viruses. Okay, they may kill about 95 to 99% of the viruses, the vaccine and also your previous infection. What happens is certain viruses mutate so much so that the vaccine and your body's immune system, they can escape your body's immune system and the virus, right? They can escape the body's immune system and the virus. So these viruses are the ones that survive and then they start to multiply. Okay, I just give you an example. Okay, you a very simple example. You have rat poison. You have rat poison. You have 1,000 rats. Okay. Now, if I tell you the rat poison is 90% effective, it will kill 90% of the rats. All right. So what happens is the rat poison will kill 90% of the rats, but 10% of the rats, 100 of the rats survive. Okay, 100 of the rats survive. So what will happen is these 100 of the rats, they will start to multiply, isn't it? They start to breed, and then the rat poison that you give to the rats won't work because why? Because these ones that can fight the rat poison now becomes the predominant species. So that is what it means by variants. So variants are mutated viruses that can survive the vaccine, and also survive the previous immunity that the person has against the virus. That is why you have these variants coming up. The concern is these variants are maybe more transmissible, may be more virulent, may cause reinfection in people who are infected, or it may cause the vaccine to be less effective or not effective at all. Now, I want to use an analogy, but it's not a good analogy. I'm sorry, because I'm watching The Godfather right now. I'm re-watching The Godfather. Yeah, for those of y'all who understand. Now, in these gangster movies, when they kill the whole family, right? They kill the whole family, and the reason why they kill the whole family, including the children, is because, including the kings last time, is if they leave any children behind, later on the children will grow up, and then the children will take revenge on all of them, right? Now, for the viruses, it is almost the same. We have to eradicate it as much as possible because these mutations occur more and more and more if there are more infections going on. So as time goes by, if there are more and more transmissions, more and more infections, the mutated viruses also have more opportunity to create new viruses. So we have to reduce the number of infections as much as possible. And when you do that, the chance of mutations also decrease, and the chance of new variants also decrease. And then later on, the chance of finding a good vaccine also increases. So that's about the variants. So these are the variants now, and you'll get more and more. You have the alpha variant, beta, gamma, and now you're having the delta variant, which is why we suspect the papers that are coming out, there are more and more cases. The delta variant appears to be more infectious than the original COVID-19 virus and more infectious than the UK B117 lineage. And it also is more transmissible, and we are beginning to see younger and younger people getting severe infections. okay, severe. We are already seeing it. In fact, one of the main reasons why it's spreading very fast in Malaysia and many countries, and including the UK, is coming up again. One of the reasons is because of the Delta variant, which is which spreads more easily. So the transmissibility of the virus is not only because of human behavior, but also the virus also has a say. So this is what happens. Brazil now is hit by COVID-19. Now Brazil is in a disaster right now. They already have almost 500,000 deaths already in Brazil. And it's because of the P1 strain. Initially, they had a big spike, and then after that, now they have another spike and another spike. So this is one reason why, you know, many people say, let the virus just fly, let the virus infect as many people as possible, and then, you know, we'll all develop natural immunity, let nature take its course. There are a few fatal flaws in this argument. Number one is, first and foremost, it will kill many people. It will kill many people. Secondly is, even if you get infected the first time, it doesn't mean that you may not get infected the second time, because, as I said, there will be mutations that can still overcome your first infection and also the virus. All right. So these are all scientific, just to show that proof that this is at least the Pfizer BioNTech vaccine, that they have enough neutralizing antibodies to fight against the virus. Now, many people have said, this is one of the arguments, the vaccine testing has been done too slow. It's not done too slow. It has been following all the processes. So in vaccine testing, you have a preclinical testing, phase 1 safety trial, phase 2 expanded trials, phase 3 efficacy trials. So it has gone through all these processes. Now, why is it being able to do very fast? Is because they have combined the different phases in order to accelerate vaccine development. So they combine phase 1 and phase 2 trials, and this is in order to get the vaccines out earlier, and they also approve emergency approval. There's a reason why it's called emergency, because our world is really facing an emergency. So these all are published phase 1 trials. I won't go through it. Okay, so this is the latest update of the COVID-19 update of the vaccine. Now, the Pfizer vaccine confirm works with all the variants, the alpha, beta, gamma, delta variants. It's the same with the Moderna vaccine, and also to a certain extent the AstraZeneca. It does work against all the different variants at different levels of effectiveness. What about the China vaccines, the Sinovac and the Sinopharm vaccine? In theory, I think it will work, but the problem with the vaccines made in China is we do not have much data to make one conclusion or another whether they will work against the new variants. We do not. As you know, many of these Western vaccines, they are the thing about the vaccines that are published in the Western journals is they are more transparent. So we know the data, we can see, what are the side effects, how effective they are, but not so with the vaccines made in China. Comparatively, we have little data. But having said that, China, the Sinopharm vaccine and the Sinovac, they are using the vaccine technology that has been used for hundreds of years. Whereas the Pfizer and Moderna, they are using new vaccine technology. So China, the Chinese vaccines are actually using the traditional vaccine, which is the inactivated vaccine, which has proven in previous vaccines, in measles, mumps, rubella, and all that, these are all inactivated vaccines to work. So although we do not have enough data, it's my opinion that these vaccines also work. So many people ask, which is better? The Sinovac vaccine is better, the Pfizer vaccine is better, this vaccine better, that vaccine better. To be honest, we do not know. Okay, we do not know, and also it doesn't matter now. What is important now is for people to get any vaccine as soon as possible. Any vaccine is better than no vaccine. So these are the different vaccines we have, the Moderna vaccine, the BioNTech vaccine, the Oxford AstraZeneca vaccine, using different forms of technology. So the Moderna and Pfizer, they use something known as the mRNA vaccine. Oxford, the Sinovac uses the classical inactivated vaccine. And then you also have the Bharat Biotech, the Indian vaccine. And then you have the Sputnik vaccine, the Johnson Johnson, and the Novavax. Now, I'm not going to go through the mechanisms of how all these vaccines work. We don't have enough time, and it's a very technical discussion. Now, they also have a vaccine adverse event reporting system, VAERS, for the Pfizer vaccines and the Moderna vaccine and the AstraZeneca vaccine. Now, this system is important. Everyone who has any bad event happening to them after they are vaccinated, whether it's related to the vaccine or not, anyone in the public can make a report. VAERS. This is very important. Now, so let's say after I get a vaccine, I get fever, I can key it and say I had fever. After the vaccine, 1 month later, a person dies of a heart attack, it can also be entered as in this VAERS system, right? A person may get cancer after that, they are also reported. But it comes with a caveat. It just reports any adverse event that occurs after the vaccine is given, but it does not say that this adverse event is due to the vaccine. All right, you must understand, it does not say that this is due to the vaccine. It just said it happened after the vaccine. So the causality is not proof of causality. And many people have quoted this VAERS system and said, the vaccine has caused it. Look at the system, it's caused so many people die here, there. Now, even without the vaccine, also people will get cancer. Even without the vaccine, also people will get heart attacks. They will get all sorts of diseases. It doesn't mean that whatever is reported in this system is due to the vaccine, but this system is very good because it allows regulatory agencies and scientists to be able to investigate all of these severe adverse events to see whether it's caused by the vaccine or not. So this is a very good system, but often the data can be misused and be used to mislead other people. Now, the vaccine side effects are pain at the site of injection, swollen lymph nodes, people may feel tired, headache, muscle pain, joint pains, nausea, vomiting, fever or chills. Anaphylaxis, 5 to 7 in 1 million. People may get a severe allergic reaction. About 5 to 7 in 1 million. That so far none have been reported as directly caused, not sure. But actually there's new data that come out that some of the vaccines have actually caused deaths. Very few, but yes, it has. Okay, this is what's in the news. Vaccine-induced thrombocytopenic purpura. Thrombocytopenia, VITT, and the COVID-19 vaccines. Now, these are seen in 2 vaccines. That's the Oxford vaccines, the Oxford vaccine, and also the Johnson & Johnson vaccine. This is confirmed, it causes this side effect. It causes thrombosis of clots in unusual sites such as the cerebral veins and the splenic veins. Splenic veins are veins in that supply your intestines and also cause thrombocytopenia, which is low platelets. These antibodies directed against something known as platelet factor 4 heparin complex, which activate platelets, and it's extremely rare, but extremely dangerous also. So now, this side effect does cause side effects in people who have this vaccine. It is actually caused by the vaccine, all right? Confirmed caused by the vaccine, but it is extremely rare. So, cerebral thrombosis means clots in your brain. 3.6 million people got it after the AstraZeneca, 3.6 per million people after the AstraZeneca COVID-19 vaccine, and 0.9 per million after the Johnson & Johnson vaccine got this. Now, if you want to compare, if the person gets COVID-19, if the person gets COVID-19, the risk of getting this brain thrombosis is 207 per million. So we have to have a certain context to it, right? If you have a person gets COVID-19, 207 per million may get it, these clots in the brain. But if a person is vaccinated, it's 3.6 million. So we have to compare the risk benefit. Now, in the general population, let's say without COVID and without the vaccine, about 2.4 per million get it in the general population. So yes, the AstraZeneca and the Johnson & Johnson vaccine does cause this side effect, but when you compare to getting the virus and getting this condition, it is almost 200 times higher, almost 100 times higher. So the risk of death and serious outcomes of COVID-19, including thrombosis, far outweigh the small risk of VITT. So this is the median infection rate. So Malaysia, we will consider it as medium. So you see from the ages of 20 to 40, hospitalizations prevented by taking the vaccine is 37. Cases of blood clots is 1.9 per 100,000 after the first dose. And from 30 to 39, 54 hospitalizations are prevented compared to 1.8 cases of blood clots with low platelets. So because of this, this is considered high for vaccines. Because of this, England and many places in Europe, in the UK, they actually give a choice for those below 40. So if you are below 40 and you have a choice between taking the Oxford vaccine or the Pfizer-BioNTech vaccine or the Moderna, people can choose to take the Pfizer-Moderna vaccine, right? You can choose. They allow you to choose which one. But in many places, there's no choice. You only have one vaccine, you have to take it. You have to take it. You have to balance the risk benefit. So my advice is for young people, it's better to take the Pfizer and Moderna vaccine, but still in cases where there's so many infections, then you may still take the AstraZeneca Oxford vaccine, but people need to know the risk, which is actually very small. So I want to go through the myths and facts about the COVID-19 vaccine. Messenger RNA vaccine. Now this is got a lot of things. Now the mRNA does not enter the cell nucleus, so it cannot affect the cell nucleus. It cannot cause cancer. It is not converted to DNA. Even if it is converted to DNA, which is not, it can only integrate into the DNA if there's an integrase enzyme, and there's no evidence that it can cause cancer. Now, the mRNA doesn't last long in the cell, very, very short. It just lasts long enough to produce enough of the crown protein antigens to induce an immune response, and after that it goes off, it dissolves, right? So the messenger RNA doesn't stay in the body long, very, very short. In fact, it's the latest technology for infectious diseases, and we hope that it can be used later to cure cancer, to help cure cancer as well. Now, many people say the COVID-19 vaccine really isn't a device. It's actually a medical, it isn't a vaccine, it's actually a medical device. Wrong. Vaccine is a product that stimulates a person's immune system to produce immunity to a specific disease and protects the person from that disease. It's not even, cannot be categorized as a medical device. Some people say it contains pegylated nanoparticles and it can cause anaphylaxis. Again, anaphylaxis is a severe allergic reaction. Again, the reported is 7 in a million, 5 to 7 in a million cases of anaphylaxis. So if people who have history of allergy, what I say is, even if you have an allergy, your risk of getting severe allergy is 7 in 1 million. And even if you do get an allergy, it is easily treatable and we can treat it. So if you have history of allergies, you can still get the vaccine, but the doctors will be ready for medicines that can counter the allergic effect. COVID-19 vaccines can cause autoimmune disease. The cause of autoimmune disease is still difficult to identify. There has been no evidence of vaccines causing autoimmune diseases, none at all. Can COVID-19 vaccine make me sick with COVID? No. There have been a lot of WhatsApp saying after the first dose, your immune system comes down and hence there's an increased risk of getting COVID. This is all based on wrong science and misrepresentation. It does not. But we can still get COVID while waiting for the vaccine to have its full effect. So there are 2 doses of vaccine, 1 and 2. Now between 1 and 2, a person can still get COVID, although the risk of them getting COVID is less, but you can still get COVID. So you need 2 vaccines and 2 weeks after the second vaccine to have the full effect of the vaccine. After getting a COVID-19 vaccine, can a COVID-19 test be positive? No, the COVID-19 antigen and the PCR test will not be positive, but the serological test, which is the antibody test, may be positive. If I already had COVID-19 and recovered, do I still need to get vaccinated with the COVID-19 vaccine? Yes, you still need, because you can still get reinfected. However, we advise the person to get vaccinated only 3 months after their COVID infection. Now, are the COVID-19 vaccines safe to be given in pregnancy? Now, in the studies, pregnant women were not included in the studies, just as any other drug. All drugs, pregnant women are not included in the study. However, we must take into account the risk of severe COVID-19 is much more higher in pregnant women compared to non-pregnant women. So far, there have been no risk adverse effects that have been monitored. We are still we are still monitoring. So what advice do you give the mothers who are pregnant? We give them a risk-benefit advice. We give them the risk of getting COVID and dying of COVID compared to the risk of the vaccine. So the vaccine is safe. So this is the latest. Pregnant people who are deliberately excluded in the first round of vaccine trial. It is a normal practice. But as of June 14, 124,597 pregnant people have received the vaccine. The CDC has closely followed 5,102 volunteers who got vaccinated during pregnancy. And there was no unexpected pregnancy or infant outcomes have been observed related to the COVID-19 vaccine during the pregnancy. Among the 827 who had completed the vaccine, 86.1 resulted in a live birth and 13.9% resulted in pregnancy loss. Now, pregnancy loss, preterm baby size, congenital death problems and death was no different from those with the vaccine compared to the usual background rate. So they were no different from the background rate. That means even without the vaccine also babies die, there's pregnancy loss. So when they compared the people with the vaccine and those who are not vaccine, there was no difference. All right. Also, 36 individuals who got pregnant during vaccine trials had no complications from the vaccine. The baby also gets protection because the vaccine produces antibodies. The antibodies go to the baby, and this also causes protection of the baby from the getting infected. So you must remember, unvaccinated pregnant people and unborn babies are at a high risk of severe COVID-19 disease. So if infected, they are more likely to go to ICU, need ventilation, need oxygen, more likely to have preeclampsia, more likely to die of COVID-19, more likely to have babies born stillborn, preterm or stillborn, and more likely to have babies admitted to the neonatal unit. So we have to balance the risk and the benefit. The risk of you getting an adverse effect from the vaccine is so much smaller compared to the risk of a pregnant woman getting COVID, getting pregnant while she has COVID. There's something known as antibody-dependent enhancement. Okay, this also has been bandied around. Do the mRNA vaccines cause antibody-dependent enhancement or ADE with COVID-19? So what is ADE? ADE is when the disease is made worse or more severe in a person who has already been exposed to the virus through a previous infection or vaccination compared to people who were never exposed and vaccinated. Now, why people are concerned? Why do some scientists say, this may happen? Well, it has happened before. It's seen in previous vaccines. The respiratory syncytial vaccine, the vaccine was stopped even at the clinical trial Measles also, you will stop in the clinical trial, and then we have the dengue virus vaccine that it occurred in children in the Philippines. Now they have the trials and all, both the trials and the real life data right now have shown definitely antibody dependent enhancement does not occur in patients who already had COVID-19 or the vaccine. It has not been seen in the previous coronaviruses, in the human studies, and also in this real life right now. The people are getting vaccinated, and there are also some people after getting vaccinated, they got the infection again. They all got very mild COVID. What I mean is, if a person is vaccinated and they got infected again, those escaped ones that got infected again, almost all of them had mild COVID. Very few had severe COVID or died compared to people who are not vaccinated at all. So antibody dependent enhancement, no sign of ADE in animal studies, no sign of ADE in human clinical trials, and I forgot to add another one, no signs of ADE in the real life human data, no signs. Herd immunity, what is herd immunity? We also hear this. Herd immunity is indirect population. The population is immune either through vaccination or immunity through previous infection. WHO supports achieving herd immunity through vaccination. That's very important. We cannot achieve herd immunity by infection because there are so many people. Allowing the disease to spread to achieve herd immunity is not effective and will cause too much morbidity and death. So what is herd immunity? So these red people are those who are infected, and these blue people are the ones who are susceptible. Now, these green people are those who are immune, either through the vaccine or through the infection. So if you have many people who are immune to the virus due to an infection or vaccine, this red fella can only spread to one person. Whereas here, without herd immunity, this one person can spread to many people who in turn can spread to many other people, affecting those who are not immune. Whereas when you have herd immunity, it protects those people who for some reason cannot be vaccinated or not immune. That is what herd immunity, it stops the virus from spreading. So vaccines are key strategy, and not the only strategy, the key strategy in us helping us to end this pandemic and bring it down to levels that we can control. That's why vaccination is so important. My friends, I mean, we are in the full gospel business association. I tell you, we cannot open up our society and our work until we get the vaccines out as soon as possible, you know. So this is what here herd immunity, it prevents the virus from spreading because it cannot. Every time it wants to spread, it goes to a person who's already immune to it. Okay, so that prevents the virus from spreading. So the proportion of population that must be vaccinated against COVID-19 to begin inducing herd immunity is not known. Estimates between 70 to 90% of the population. Example, measles requires 95%, polio, the threshold is 80%. So you can see why I'm advocating, and all of you, please use whatever influence you have with the government, with anyone else, to tell them to ramp up our vaccinations in Sabah. Sabah is only about 3.5 million people. You know, we can do it. We can vaccinate as many people as possible. What's so difficult? You know, we can register people to vote. We can't register them to vaccine and get vaccinated. So we have to do it fast. We have to do it fast. So the risk of finding yourself in a different situation, I'll just go to here. Unvaccinated, both people are unvaccinated, probability of transmitting is high. One person unvaccinated by wearing a mask, the other person unvaccinated but wearing a mask, the probability is much lower. So that is why masking is important. Unvaccinated and masked, and this person is unvaccinated, the probability of the fellow who was vaccinating transmitting to the person who is unvaccinated is lower if one person is wearing a mask. So two people wearing the mask is the best. And the best is both people wear the mask and vaccinated. So the possibility of transmitting is low. Now the question is, Now, if both people are vaccinated, why do we still need to wear masks? And this is where we need a bit more patience from the public. Yes, both are vaccinated. The risk of transmitting the virus to each other is very low, very, very low. But I would ask, as an infectious disease specialist, is to please bear with us, bear with the people for a while, wear the mask for a bit longer. There will come a time where we will not wear a mask. Why wear a mask now is because the variants of concern are coming out. The variants of concern, the Delta virus, the effectiveness of the vaccines against these new variants of concern is less, which means to say that people who are vaccinated can still get infected again, although the infection is less, but we really want to eradicate this virus. We really need to win this battle against this virus. So my friends, I'll end here. We are in this together, we are in this together, and we will get through this together. It's been a long haul. All of us are tired. All of us are fatigued. Our children are not going to school. Our businesses are affected. Families have lost. People have lost their lives. Families have lost their father, their mother, their children, their grandparents. The world is going through a very, very tough time. But we will get this together, and we will have to get this together to get through this together. And of course, us being Christians, I tell you, just like people of the Old Testament, we can only plead to God to have mercy, to have mercy on us on this planet, because this is really a horrible plague. With that, I would like to thank you very much.